All right, we'll get started. Good morning. Thank you guys so much for joining us. If you don't know, I'm Alan Rippin. I'm the director for the Center for Active Living at the Council on Aging. And Eve Anthony, our CEO, is here with us. And we thought it would be a good time to check in as we started the new year. We've all collectively been through so much in the past year, and wanted to sort of check in and just say, what we've been up to, what we've been doing these past months, and how we've been responding to the pandemic within our agency and sort of with the community, and where we are now and what we're thinking for the next 3 months. I mean, it's hard to plan very far in advance right now, but and just answer any questions that people might have. So I'm really just going to pass it over to Eve, and then at some point we can ask questions and talk and have a conversation if we need to. So I'll pass it to you, Eve. Thanks.
Okay, well, thank you, Alan. And yeah, certainly, since it is a smaller group, we could definitely make it more of a conversation than me just spouting out. But it's good to see everyone. And what I can do is just start with a quick recap of, kind of the trajectory of how ACCA got to where we are today. It's, I think all of us think pre and post pandemic at this point, and I think everyone's work looks very different these days, and certainly ours does, and our agency does as a whole. We were prepared for us to close on March 16th. We've been paying attention to the news, had been talking to some of our local officials. And so when the decision was made to close, we had emergency food ready to go out with our clients. Meals on Wheels was set up with enough volunteers to sustain for as long as we knew we needed to. So we felt, although the idea of closing and looking at the future was daunting and a little bit scary, we felt prepared. We closed on March 16th, and then we met with our full ACCA team, and we made a commitment to our community and to each other that no senior would be left behind and no paycheck would be lost. And so all of our work over the last 9.5, 10 months has been focused on those. And then we looked at, based on the first phone calls we were getting from our community, what were the most urgent needs, and then what do we do best, and how can we combine those two, and really looking at Meals on Wheels, and the way that our Meals on Wheels program was designed is how do we take that and roll it out to our entire community of seniors. And so we focused all of ACCA's resources into 3 areas, and that was emergency food relief, safety checks, so making sure that the vulnerable seniors that we serve, and then all of the new seniors that we serve, would feel safe while they were sheltering in place. And then also making sure that there were socialization opportunities, which we all know can be challenging when we look at the different ways that we're able to engage with seniors who are sheltering in place. So those were our focus areas. In addition to that, we had programs such as our long-term care ombudsman, who, immediately they were not allowed to go into those long-term care facilities, and families very quickly lost access to their loved ones. And so that became an emergency situation that our ombudsman were working and continue to tirelessly work with long-term care facilities, families, and their residents to advocate and to just get information about what is going on in some of those facilities. And we'll kind of talk about that as well. And then our employment program, it still continued to have trainees on site throughout the community when they were able to. And then for those seniors who did not have a place to train, equating to then they didn't have a paycheck, we were able to offer in-home training opportunities for them so that they never lost a paycheck during this the pandemic and while the program essentially is closed. And then, like I said, our other programs were supported by Emergency Food Relief, and then so incredibly proud of Alan and Michaela, who for years we had said we need a virtual senior center program because we already knew that there were seniors in our rural communities that we weren't reaching. And then homebound who couldn't get to the senior center that we weren't reaching. And so it was something we had talked about for years and really just couldn't get it done. And then it was almost overnight that Alan and Michaela created this wonderful virtual programming. And when we talk about virtual, again, we're looking at seniors with different abilities. So not only are they doing online Zoom like we're doing, but they're also doing telephone programming. Alan has done Name That Tune and other activities over the phone with our folks who don't have access to internet. And then we're doing things like we rolled out the ACCA party bus and went and visited a lot of our folks in their driveways. Our senior center staff, along with our adult day health staff, they're making the deliveries of food and they're doing activity bundles for folks, and they're just doing social visits. And while they're doing that, they're making sure they're saying hello and checking in, and they're all doing this by contactless social visits. And then our adult day health program, when we closed that program, that was incredibly challenging and scary because that's a very vulnerable older adult population, many of them living with Alzheimer's and dementia. And so how are we continuing to support those folks and their caregivers? And the biggest obstacle was all of a sudden we had 40-something people who needed home health care. And reaching out to your traditional home health companies and the companies that were funded through Medicaid, there weren't enough to quickly answer the need that we had. So we were closed, so our aides for a while became home health aides to help out family members and provide respite as needed. And we have a couple of aides who are continuing to do that in homes, is making sure that there's somebody there so that the caregiver can continue to work. So we've been very specific in our responses, trying to meet the most urgent needs of older adults, but then also been very creative and innovative in finding ways. And then, the thing that I always tell folks is I love working for a nonprofit, as others on this call could probably say the same thing. And part of that is because we don't always have to hear no. We can be creative and innovative when some of our partners in working with older adults are kind of stuck in a regulation box where we are not. So it was nice to be able to always say yes in response to the questions that people have asked and the needs that they brought to us. So we feel incredibly fortunate that to be where the position that we're in now. Any questions up to this point? I know I'm kind of all over the map, but so where we are now is
I'm sorry, Eve.
Go ahead.
I was muted. I didn't know I was muted. ADH is still not meeting, right?
Correct. So ADH, and you all may have heard this as well, adult day health across the state really is in a crisis mode at this point. We've lost what we think of at our state association of probably 7 centers, and there weren't enough centers to begin with.
Oh, no.
And that's just all that we have heard of. We don't know when when centers do start to reopen, what that's going to look like. The challenge in adult day was that we did not receive the same level of funds, Medicaid retainer funds, as other Medicaid providers. We're not typically included in long-term health, and we're not typically included in as a healthcare facility. And so because of that, we're a huge gap in what we're eligible for. The state did Medicaid, DCH, we did receive 90 days of retainer payments. But then they offered where we could bill telehealth. And those of you at the Alzheimer's Association will appreciate this challenge. So they offered us telehealth where we would have our clients sitting in front of this for 5 hours a day. And we were very limited in what we could offer them. So it would have to be education about their chronic disease, education for the caregiver, some activities, but that's impossible. But you're not going to get someone with Alzheimer's and dementia to sit in front of a Zoom
Well,
call.
it's not healthy. It's not even advisable to sit
No,
for 5 hours.
no, it's
And yeah, so they were trying to keep up that 5-hour requirement, and yeah.
yeah,
Well, my gosh, it's just making me sick. So I probably am a bad one to comment on this because
yeah,
it's so essential. It's so essential. And like you said, we didn't have enough to begin with. And I'm heartbroken about it.
yeah.
I'm
And
sorry.
the safety risk and is so then now if we do have centers who are reopening, they're reopening when some of them are doing it safely, but some of them are reopening when they shouldn't be open, and they're open because they need the revenue. And then others, so as we're considering opening our adult day health, there's no way we're going to open without a vaccination plan. And again, ADH was in the gap. We're not considered long-term care facility. We're not considered a healthcare facility. So we were not prioritized as far as vaccines go for our staff. However, we have done, working with Leading Age of Georgia and the Adult Daycare Association, we've done a lot of advocacy at the state level. And at this point, we do have some ways to work with public health and kind of get around that. So our adult day staff is now eligible and can go ahead and get the vaccination. So adult day health really is going to need some continued advocacy. We're working with, we had a meeting with the commissioner, DCH commissioner last week, to talk about some help that they could possibly give, looking at pre and post pandemic, or during pandemic and after the pandemic. And so they are looking at possibly making some changes to the Appendix K waiver. And that's that waiver that said we could offer telehealth at 5 hours, but could they be a little bit more flexible? Our adult day, for example, we're providing food assistance, we're providing activities. And then our nurses are still doing medication assistance. So they're still filling pill counters and helping folks get medications from pharmacies. They're checking in, but we're not getting reimbursed for any of that. So, our ask of Medicaid is, can you just reimburse us for the services that we continue to do because it's the right thing for us to be doing?
So are you on a moratorium of, I guess you can't accept new for the ADH, for the food and does it make sense to even refer to you right now, or are you putting people in a line, or no?
Yeah.
What does it look like? I'm just curious, like if I come to ACCA, is there anybody in the ADH? Are the nurses there? No.
Well, a little bit. So, and I probably need to go into a different storyline for it to make sense. And
Well, I'm sorry, I don't mean
Oh,
to
no.
pull you off your focus. I just want to know.
No, I very much want this to be a conversation. So that's no, please continue to do that. But so all of ACCA looks very different. So Mary, you're very familiar. So if you were here, everything looks different. Because we are closed to clients, and then as part of our safety protocol, we divided into 2 teams. So we're an A and B team. So half of our team reports to our campus each day, and the other day. So we're an every other day rotation. So the nurses, every other day, we have 1 nurse each on site. Part of what they're doing now is checking temperatures of staff. And then everybody is focused on COVID emergency food relief efforts. So they're doing that. But so the staff is there, but the daycare is not set up. I mean, every room in ACCA is a mess, is what I say, but it's a healthy mess. It's like good trouble. This is a good mess. It's because we have been nonstop without a break. Just responding to the most urgent needs of the seniors in our community. And so most of that is emergency food relief at this point.
I just have to say thank you. I love you all. We love you all. And I just want to cry right now because, like you said, I know you guys. I used to be one of you guys. And it's made me feel as a statewide as somebody who manages a statewide program for the Alzheimer's Association, it's made me feel very confident about the needs of the folks in Athens, at least for the, food, basic necessities. But before I have to get off, I just want to say I'm here. Allie, love to partner with you. Anything virtual education as far as early stage. Kim does the general program, education programs. But thank you so much for the work you're doing in it. Thank you.
Thank you, Mary.
Too.
We hope to see you soon, or I hope to see you soon.
Me
I'm
too.
sorry I have to leave.
Yeah.
Joining. Mary.
So that kind of leads me to, and we'll come back probably to the adult day conversation when I talk about future, because and from what I have seen in the conversations I've had, there's a lot of post work that we're going to need to evaluate and look at. When I consider the populations that have been the most affected, I look at people living with Alzheimer's and dementia and their caregivers, and then I look at people who are living in long-term care facilities. So we'll kind of talk a little bit about that. But as an organization and as a nonprofit, the biggest challenge is our programs that close were our revenue generating programs. And if we're not operating, we're not generating revenue. So at the same time that our revenue took a catastrophic dump in the spring, the need for our services took a overwhelming increase in demand. And so again, it was kind of like I appreciate our staff, and I will go to my grave probably the last breath of saying thank you to this COVID ACCA staff, because they took a leap of faith alongside all of us and showed up every day. And because of that, we just kept continuing to say yes. And we had a lot of faith that when the resources were going to come and they were going to support us, if we just continued to say yes to every need that was out there. And we did it not knowing how, A, we were going to logistically meet the need, and B, how we were going to pay for the need. I looked at our numbers this morning because I haven't looked at it as a whole. So prior to COVID, so the last 12 months prior to COVID, we had delivered or provided 82,000 total meals to our community. In the 9.5 months since COVID, we have provided 277,000 meals to our community. We're averaging about 1,500 to 2,000 meals a day. And then prior to, we were serving 135 people. As of last Friday, we've served over 6,000 people. So you could see our response has been great. And part of what we did is we just chugged forward. We created a program. We took and we realigned all of our staff to different job descriptions because their work previously was not there. And we created the emergency relief food program that focused on those 3 areas that I talked about: food, safety checks, and socialization. And then our county reached out to us in May and approached us about taking a model that we have and how do we serve our entire community with the ACCA food relief model. And so it took several months to work out a contract, but beginning in September, we launched a program called Athens Eats Together. And Athens Eats Together is a $2.3 million contract to provide food to the entire Athens Clarke County community, not just older adults. So we partnered with a catering company who, again, their business completely shut down as well. but they had the means to produce large amounts of frozen prepared meals. And then they had the logistics of venue space that we turned into food packing and operations space. They had refrigerator trucks. They had the staff that understood logistics, where we don't understand some of those delivery logistics. Partnered with them. We partnered with Georgia Ground so that we could have a contact with the local farm, so that we're sure to always have the vegetables, the eggs, milk, the things that we need. We partnered with our local farmers market to provide vouchers for the farmers market, and that's probably been one of the most successful parts of Athens Eats. Is, for years the community talked about how do we have more diverse populations utilizing our farmers market? How do we get people to not feel like it's more of an, and I hate to use the word, but some of the feedback we've gotten is it felt more elitist than welcoming and inclusive. And so by offering this program, we've had a lot more people. They're averaging about 100 more people at the farmers market each weekend. And then we also partnered with a group called Collective Harvest. And Collective Harvest is a local organic group that brings together farmers from our local area, and they provide produce for the bags that go out each day. So the purpose of Athens Eats was not only to support the people who need the food, but to support some of our local businesses who have also lost. And so by doing that, we were also able to ensure that we had employment for all 67 of our staff. And so we've been very, very, very fortunate that we, although our revenue dropped from our traditional programs and our traditional work went away, that we have full-time positions available. And we've actually hired a position to help us out with Athens Eats Together. So because of this project, ACCA is sustaining and will be able to continue sustaining for a long time. And that gives me personally a lot of gratitude. So before I move to what's next for us, any questions about what we've been doing?
Well, Eve, I just want to say your leadership through this time has been incredible. And we're very appreciative for you and the steady hand you've shown and the compassion. And, it takes true leadership to get through this kind of thing. And, for seeing what's possible beyond what we could even see and believing in that vision. And so I just wanted to acknowledge that we appreciate that. And our clients do too. So
thank you, Alan. I really appreciate that. Like I said, I will forever be grateful for you all for coming along. It really so much was an act of faith. And I appreciate y'all doing that and continuing to do it, because as we move to the future, that's going to be an act of faith as well.
exactly.
Yeah. I think, I think everyone who's gone through this pandemic, as a collective community, I think what we all know is that there's no way we can predict tomorrow. I love now, in the business world, is how forgiving everyone is of schedules and technology and all the things that used to get us really worked up in the past. We're like, yeah, that's where we are now, and we're totally good with those things happening. We understand. And so our hope is our Athens Eats contract goes to the end of January. With the COVID numbers the way they are now, and with our conversations with the county, we know the need doesn't end at the end of January. But going into this contract, we were very clear that our priority is to reopen our services as soon as we can, and our priority is to the seniors in our community. So looking at that, we will pull out most of our work with Athens Eats, but we'll continue to fill a need at some level. And that's what, in the next week or so. Oh, I have a visitor. Oh, my puppy just woke up. Sorry. But we will continue to meet that need in some capacity through the spring. We're just not sure what that's going to be. It won't be at the same level it is now because our staff and our leadership needs to focus on how we can safely reopen. Right now, our plan is to reopen in April. The majority of our services, we're not saying we're going to open the doors wide and have everybody rush in. We know it will be a soft opening. We're not sure which programs will open come April, but it's going to be based on where we are in vaccination schedules, where we are as far as numbers in our community, and then the comfort level of the people that we're serving and our staff. So that's what the plan will be in the next couple months, is to figure all that out. And I have to apologize. My puppy is chewing on my arm, so let me just clear him out of there. See, these are the things that we're forgiven for. See, look at him. I'll be right back. I apologize. Sorry.
The work from home has its benefits, has its perks.
That's right. And I think that she's right on. We've learned to forgive that, but also to appreciate that in learning,
Exactly. Well said.
I am so sorry.
Yeah, that's great.
Now he's going to go out there and bark, but that's a little bit better. Yes. So, and none of this is, our plans aren't in concrete, because we just, as we have the last 9.5 months, we're just continuing to be fluid and go with what happens around us and the things that we can't control. We have, because we've done so much food relief, and if any of you have been to ACCA, I know some of you are part of who we serve, but our big room, our Harris room, where we used to do line dancing and group meets and things like that, is trashed. And that's because of all the food that's coming in and out of there, the thousands and thousands of pounds of food and fresh produce and everything else. So part of what we're going to do is some much needed renovations to that space. We'll be replacing the flooring. Our hope is that when we do reopen, it's going to be this fresh new space for everyone that also kind of gives everyone that fresh new renewal. So we're really excited. I don't want to share too much because I know some of you are going to be at Center for Active Living, and I do want you guys to come in and be surprised and awed and know that we're working on the space for you. Sorry, I lost my door open there too. Any questions? Okay. I'm so sorry. Sorry. This is probably the worst it's been for me in 10 months. I am so sorry. So where was I?
Eve, where are you getting pooling your information from to make these decisions about when to open and all that?
Thank you. I appreciate that. So a lot of it's coming from, just hearing what everybody hears, or what are the numbers in our community as far as the cases of COVID. So what is the overall risk? Talking to local and state public health officials, talking to some of our state organizations who are not, they're not mandating when we can and can't open, but they're giving recommendations about when we can and can't open. So that's been very helpful, as well as some safety precautions. Talking to our local leaders about, what is their request for us. Our local government has been much more on the safety side, as far as, they're less likely to reopen some other communities, and we don't want to do anything that would breach that relationship as well. So, definitely listening to them and their recommendations for when we bring people back together to congregate. talking to staff, talking to our board leadership, talking to what other organizations like ours across the state are doing, and what are their reopening plans has been very helpful as well. And I think, as we do the logistics of reopening, because we're going to have to reassess our adult day health clients before they come, so that's going to take some time. We're going to need to talk to our Center for Active Living and our Cal Plus clients about, what is their comfort level, because we want to make sure that we're making our safety decisions not just on what we see, but on what they're going to feel comfortable with. So we want to blend the two. But then, our work over the next couple of weeks is going to be really focused on vaccine promotion. We from ACCA are going to start a vaccination campaign and really encourage people to be vaccinated. Right now, our speaking with our Northeast Georgia public health officials, several of our staff members are already eligible as part of that 1A when you look at the priority. And then starting January 11th, all folks age 65 plus are eligible for the vaccination and can register. And so we are adding to all of our safety scripts. So when our folks are calling our clients and talking to them, we're going to talk to our clients about getting vaccination and to see if they need help registering for that vaccination and helping them do that. We're also, public health is going to start rolling out mobile vaccination clinics, and we've talked to them about being high on the priority list to have one of those mobile vaccination clinics at ACCA. That's to get our staff and then any of our clients that may want to be vaccinated and are comfortable coming down to ACCA to do that. But also then talking to the community about how important vaccinations are. We had an all-staff meeting yesterday afternoon, and our long-term care ombudsman coordinator, Liz Schultz, had some really, I thought, we had a compelling conversation about how important the community being vaccinated is to the residents of long-term care facilities. Again, when we look at the true victims of this pandemic, I mean, our older adults who have lived through it in long-term care, I think when those long-term care facilities reopen and we are able to go inside, we're gonna look at this as a tragedy. Our ombudsman, the type of calls that they're getting now are incredibly hard, and they're sad. And I have a loved one in a nursing home, and I know personally over the last 6 days I've called up there twice each day to try to get some information on the loved one, and it's been challenging. The flip side of that is long-term care facilities are working incredibly hard to take care of the people. They're doing it with less staff than what they need, less resources than what they need. They're doing it often when their staff are quarantined or they have horrific situations going on around them. So I do hope at the flip side of this that all of us in aging and outside of aging really considers advocacy. This is the perfect time, and it's right to look at long-term care reform that we've been talking about for years and years and years, and making sure that long-term care providers have the resources they need to pay the folks that they need, so that you have good quality staff and enough staff to take care of the people who are in those facilities. So I'm hoping that we will have some advocacy, that ACCA will be a part of that. But for today, our advocacy to help people in long-term care facilities is to encourage everyone in the community to be vaccinated. We can't protect your grandma in a nursing home unless the staff going into the nursing home are protected, and we need the community to have less numbers for everyone to be protected. So that's going to be part of our advocacy, is help us protect those who are the most vulnerable among us by being vaccinated. Any questions or comments or?
Question. Are there any new like health mandates for you and your team prior to opening back for April?
You know, that's a good question. We haven't, I've been trying to determine that. I've also tried to determine if there's health mandates for our clients. But as far as I can tell, no. Internally, we have policy and protocol in place for health mandates for our staff, and we have policies in place to mitigate the risk of exposure, but then we have policies in place. How do we respond to exposures in COVID cases? So, and that's again, you know, we've created that protocol based on the law, you know, legally what we had to do, but then also what public health has recommended we do. So, no, at this point, and again, those are the type of things that concern me. Just like when we closed, we really didn't get much guidance from anyone on the proper way to close. We pulled out our emergency relief manuals, our emergency manuals, because we had them in place. But I mean, honestly, I think the last time the pandemic portion of our emergency manual was updated was probably in the 80s. So, but we did have emergency policies on how to close for a disaster. So we referred to that. I think we didn't see the same kind of response as quick as we needed it from the organizations that we would have expected it from. So I don't know that we're going to get it for reopening as well. I think what most government entities are figuring out is they're limited in what they can mandate to private business, and we're still considered a private business. So we'll see. I do hope that they put something into place, though, because we will follow all safety protocols, but you worry about the providers that won't.
Right, and then your target is more vulnerable, so.
Absolutely.
So for any clients, you know, watching now or later, what's the recommendation to take that first step towards getting a vaccination? Where do they go? Do they call their doctor? Do they call us? Do they, you know, how do we get the ball rolling for them?
I would suggest calling your doctor first. And then from there, going to the Department of Health website. There is a Northeast Georgia, and I can share that with you, Alan, to share with the group. But the Northeast Georgia has a line, and then the state of Georgia has a hotline for vaccinations. Speaking with our local public health, they are, and I'm sure you all have heard the nightmare stories, that you're waiting on hold for 3 hours before you can talk to someone to book an appointment, and then often you're disconnected and you have to start the process over again. They've updated their system, the Northeast Georgia has, and they're hoping it should be worked out all the kinks by the beginning of next week. And so they suggested waiting until the beginning of next week if you're going to call. The online form, a lot of people had hope with the online form. They were receiving about 700 online submissions a day. So she said that you actually probably have better chances of getting it if you call instead of do the online form. So my first suggestion would be to contact your doctor and ask your doctor's suggestion for how to get the vaccination. Some doctor's offices do have the vaccinations in their offices, if they are a provider. And that's ACCA, because we do have nurses on staff. We are looking to see if it's at all possible for us to give vaccinations as well, but the storage of the vaccinations is challenging. And so unless there's you know, some way public health can help out with that, I'm not sure that we'll be able to do it.
Yeah, thanks for that. Any other questions from anyone?
I just want to make a comment. I think that, hi, Eve, and hi, everybody. I think that it is excellent that you're considering educating the clients and staff, because the feedback is that even some healthcare personnel are refusing to take the vaccine. And I think in educating, if you add the point that trying to schedule personally to get the vaccine by online is fine if you have access to a computer. And the thing is, once you've done that, you feel as if it's taken care of.
Mhm.
But I did that and I had absolutely no feedback. There is a number, a hotline number, and it's very frustrating, obviously, because of the number of people who are calling. But even when you think you make contact, you get interrupted and you're disconnected because of the input, the overflow.
Yeah.
So that is a very frustrating exercise. And in educating, if you just advise people to have a little patience, if they are going to try calling a number or going online, just have patience and eventually it will happen. But for the people, the type A's and the personalities who are used to doing things very quickly, it is frustrating.
Mhm.
So I'm glad that education is key where, in your future plans, because that is crucial for the people out there who really need to take the vaccination. And thanks for all the programs that you have in place. It has helped me and kept me mentally stable, if nothing else.
Yeah, that's good. I'm glad to hear that. Yeah, thank you for that. I know that process has been a challenge, and I'm going to continue to work with our health department. They've been so overwhelmed, and I get it, and I think they've done a good job, but it's been hard for me to get in touch with some of the higher ups, but I'm going to continue to see how we as an organization can make sure that some of our most vulnerable 65 plus folks don't have to go through that process that you're talking about to get vaccinations. And is there a way, they offered for us, for our staff, is one person can call and make appointments for 10 to 15 people for, so that all of our staff can go quickly and be vaccinated. I'm hoping there's a way we can do something similar for some of the older people as well, as to help assist them, so that, because that's going to be more than a lot of the folks that we serve. Some of our most vulnerable homebound folks are going to be capable of doing, but they're the ones at the biggest risk, and they need to have vaccination. So hopefully in the next week, I'll have an update and say that, there's a way that ACCA is going to work to get those out to you guys.
Yeah. In touch.
Good luck. I hope that you get contacted soon and are able to get your vaccine.
I'll keep you posted.
And I think a lot of our promotion around vaccine, and what I hope it makes a difference, is I'm not sure how much it did for masks, but the way that we took the mask approach was wearing is caring, and making sure people understood that when you're wearing masks, that you're protecting the most vulnerable in our communities. And so when we talk about the vaccinations, I know I personally, I don't like any medication, period. I don't like it. I don't like taking medication. I don't like trying new medications. It scares me, always has. So the idea of getting a vaccine is terrifying to me. I don't want to do it, but I will do it 100%. As soon as I am able to, I will get the vaccination, because it's so incredibly important for everybody around us. So, my hope is that other people feel the way I do, that you may not be comfortable with it, but if it even saves one person, then my comfort, that's irrelevant. So hopefully other people will feel the same.
Uh-oh, the screen froze for me.
Oh, there you are.
Oh, good. That froze for a very long time for me. Was I frozen for you all?
Yeah.
That's
Yeah.
All right. Well, I guess to kind of conclude everything, I want to end on a even more hopeful note of, Eve, we talk about how difficult it is, a challenge it is to, as a leader, to think in the, in the future right now and plan and envision. And it's like, we're still looking kind of 2 steps in front of us right now. Once we get through this vaccination period, what do you hope and what do you see? And, we talk about this idea of renewal. We're talking about it for our next issue of Connections. And we talk about it in the environment we're going to refresh, at the agency, as we kind of start this new chapter. What do you say to that idea of, this renewal and taking what we've learned and bringing it forward, and our hope for even though we can't plan specifically everything, what do you want and see coming?
I want us to see some, and I think the renewal is such a good word, Alan, because when I picture it, kind of what April is, and it's a perfect time of year. It just feels kind of like spring. So I don't in any way expect April 1st, kind of like I didn't expect when we hit midnight on January 21st for things to be better. I don't expect April 1st for everything to be what it was. We're going to have some, from every expert, we are the fall before we really are starting to look anywhere near normal. So I don't want to have the expectation, nor do I want to give the expectation that April 1st, everything's going to be great. What I do hope is that April 1st, we can start to see the light, that we're starting. My wish for April 1st is for everyone to be overwhelmed with hope instead of searching for hope. And so that's part of what ACCA, when we talk about renewal and we're giving that message and we're talking about vaccines, all of that is to say we're moving forward, we're coming out of this, we're in dark days now, but April 1st, we're going to kind of switch from those dark days to where we're trickling in. Does that make sense? Mm-hmm. Yeah. So I think it's going to be a slow, soft renewal, but we're going to see and we're going to be working on renewal. At the same time, folks with Alzheimer's Association and other statewide aging advocates is to really look at what went really well and what went really wrong and how do we make that better.
Yeah, I agree. We're looking forward to that. We're in that process now. So yeah, thank you. Well, thank you again so much for all you've done for the agency and the community and everyone on the call and who will be watching. It's taken all of us to get through this, and it's been such a period of contrast, of sort of real darkness and real tragedy, and then real hope and resilience. I always come back to, like, those of us who are here. I mean, the resilience is incredible, and while that's kind of an internal thing, I think you can't have that without the community and the agencies and your fellow friends and citizens. And so it's been pretty great to see us come together and help each other get through this very, very difficult time. So hopefully brighter days ahead.
Yeah, absolutely.
All right. Well, thank you all so much for joining us today. It's nice to see a few familiar faces, and we'll be in touch. Hi, Nikayla.
Thank you, guys. It was good to see everyone.
Bye.
Thanks.
Bye.
Bye.